Looking at the research on the staffing levels, Dawn, what conclusions can we draw about staffing levels and the balance between registered and healthcare assistants?
For the topic today, I looked at the RCN employment survey from 2011, 2009 and 2007, which is probably the main source of evidence I could find on our current staffing. And what that shows is certainly since 2007, there has been a decrease in the proportion of registered to unregistered nurses. I think one of the key issues is that there's an overall decrease, but there's considerable variation in specialties. So the proportion of registered to unregistered nurses in care of older people's units is much lower than the proportion of registered nurses to unregistered nurses in areas like paediatrics and medical surgical care.
Mm-hmm. Part of the Care Quality Commission's conditions for registering health and social care organisations is that they have sufficient qualified, skilled and experienced people to carry out the regulated activities. Is this process robust enough to reassure patients and the public?
I think it's very difficult because there are a variety of different methods that you can use in order to identify established staffing levels. Going from very basic number of registered nurses to number of patients, looking at the proportion of registered nurses to patients, or you can use systems which look at patient acuity and dependency and relate that to the number of registered nurses you need. And I think there's some trusts in the country which do that very well, and there are some trusts in the country which perhaps have not used those processes as well as they could have done. So it's very hard. That there's obviously some failing somewhere, because otherwise we wouldn't be here talking in the Mid-Staffs Inquiry, and we wouldn't have had some of the reports that we've had in recent years about patient safety and concerns about staffing. So partly it's to do with the systems that trusts are using to identify establishment, and whether or not they're linking that to outcomes. So to do with, can we, if we play around with the nurse staffing ratios, what impact does that have on our outcomes and our complaint rates? And they perhaps haven't been using those processes as well as they could have done.
Both are important.
Yes.
Is there an ideal way to staff different types of services, such as A&E wards or wards for older people?
Again, I think that's it's a very complex issue, because it's not just to do with staffing, it's to do with all sorts of other issues to do with culture and organisational values and all the things we've been talking about this morning. And nobody can tell you what an ideal staff ratio mix would be. As I said, there are the systems that identify patient acuity and dependency and relate that to registered nurse staffing. Certainly in California, they have minimum nurse to staff patient ratios. So in an accident in emergency department, it would be one ratio. In a medical surgical ward, it would be another. So for instance, in medical surgical units, it would be 1 to 5. If you're in a telemetry unit, so an area where patients need monitoring, it will be 1 nurse to every 4 patients. Now, those are fairly arbitrary standards that California have set. They're not based on any evidence. And I think that this is the big issue, is that there's no simple way of doing it, and it varies depending on the unit and the complexity of the patients. Although I would suggest that the ratio of 1 registered nurse to 11 patients on a care of the older person's unit that the RCN employment survey shows is our average is possibly too low.
Would setting minimum staffing numbers guarantee better outcomes or patient experiences?
Not necessarily. And there's a large body of evidence, predominantly from America, which suggests there's an association between more registered nurses and better patient outcomes. But we have to be very cautious about interpreting that evidence, because there's all sorts of other things that could have affected those outcomes. It could be that when you have more nurses, those nurses are working in organisations which have more resources, which have a culture which focuses on outcomes. So it's not just the number of nurses, it's all sorts of other things which impact on outcomes as well. The most latest research from America, which compares the outcomes for patients who have been cared for in California, which do have mandated minimum staff ratios, to Pennsylvania and New Jersey where they don't, would suggest that more nurses leads to better outcomes. But again, it's not a causal relationship. So it's not, you can't say for certain.
Are there things that could help trusts understand the tipping point between safe and unsafe staffing, or the point at which investing in more people would, the benefits would not be outweighed by the cost?
Yeah, and I think, again, it's not a linear relationship. So if you have a reasonable level of staffing, then putting more money into registered nurses is not necessarily going to improve outcomes. I think that there's probably some way to go for some trusts to meet maybe a minimum staffing ratio. It's very hard. I think that the thing would be to, if you're considering to change your nurse staff patient ratios, then you need to also be monitoring outcomes to see what's happening to those outcomes. Are they improving or are they getting worse? Personally, and this is a personal view, I think that there is a case for perhaps we should be looking at minimum nurse to patient ratios in some areas, but we have to be aware that they are inflexible, and therefore there could be some cases where that's the minimum, and probably there are some areas where they need to be more than that. So it's difficult. It's very complex, as you probably all.
But there are unintended consequences of setting minimums.
Exactly.
Are there particular service areas that would warrant that approach more than others, and which would you suggest?
Again, this is a personal view, having looked at the RCN employment data. I think I would be very concerned if one of my loved ones was on a care of the elderly persons unit where they had one registered nurse for every 10 or 11 patients, compared to paediatrics where it's 1 in 4, or medical surgical where it's 1 in 6 to 7. I think that would be the area where, if I was going to put it in, but older people are cared for across the hospital, so you know.
The case for introducing minimum standards for care of the elderly wards, therefore, would be to raise the bar rather than set an absolute minimum.
Absolutely, and raise the bar to perhaps the equivalent of other areas in the hospital, because at the moment they're considerably understaffed with registered nurses compared to other areas in acute hospitals.
Dawn Dowding, thank you very much for sharing those insights.
My pleasure.